have a case of cervical myelopathy. What am I suffering from? Numbness, tingling, pain, shooting pain, mainly in the hands and in the legs. I know from experiences of other people, like in my case, that many people were really have benefited, like maybe 70%, 80%, they were improved. If I improve like 30 to 40%, I'll be very happy.
Can you please tell me what's your name, where
Yes.
you're from?
Yeah, my name is Hisham Abdel Hadi. I'm from Jordan, but also I'm Canadian and currently working in Oman.
And what brought you to the clinic?
Yes, my condition, I have a case of cervical myelopathy, and after going to many hospitals and many places, I was advised to maybe look for stem therapy clinics. And I looked for that in the internet and found the
Swiss Medica?
Swiss Medica in Switzerland, and the clinic is in Serbia. This is why I came here.
All right. And can you please tell us about more about your symptoms? How it was manifested during the day? What was the symptoms?
The symptoms? You mean what am I suffering from?
Yes.
Oh, okay. That is persistent to my case, which is numbness, tingling, pain, shooting pain, mainly in the hands and in the legs, especially in the feet, with burning sensation, and then a feeling of lack of balance. This comes from the myelopathy of the spinal cord.
And how long does it last? Those symptoms?
Oh, well, that started with me back in 2018, January 2018. So it has been for more than 5 years, 5.5 years.
And you was diagnosed in that time as well, right?
Yes. After the injury of the spinal cord that happened, maybe because of stenosis at a certain part of the spinal cord, the neck. Yeah.
Yes. And what did you do when the symptoms appeared? What did you do to cope with them? Medications, treatment, therapies?
Medications, physiotherapies, gabapentin pills for nervous conditions like that. Yes, only this, and sometimes swimming and walking, whatever I could, I did, but the case did not improve.
At all?
At all.
Mm-hmm. And can you please tell one more time about stem cells? How did you come up with the idea of trying stem cells?
Yes, I read many times through the net, mainly through the net, about conditions like mine. Like if you go to the net and read about myelopathy, is it curable? They will tell you, unfortunately not, using available medical resources. But the only hope is maybe through stem cells that could fix many damages in the body. There's a chance that could be done, but no guarantee for that.
Yes. And when you decided to try stem cells, have you got any fears, concerns, obstacles before trying stem cells?
Yes, there is the fear that there could be some reactions from the body, because the stem cell treatment is not a proved treatment so far. In fact, in many countries you cannot have it; it is illegal. So you are running the risk that some conditions could happen to you, but the hope that you would improve, this is the thing that is driving me to do it.
And can you please tell about your expectations more? What you expected the most to have after the stem cell treatment?
I know from experiences of other people like in my case, that many people were really have benefited, like maybe 70%, 80%, they were improved. Others would improve partially. If I improve like 30 to 40%, I'll be very happy.
Mm-hmm. And can you walk me through the process in the clinic? What was it like? What kind of stem cells did you do? I mean, donors or own stem cells? Was it painful? Was it through IV or in some different way of administration? Can you please tell about
Yeah,
the
yeah.
process?
The information I knew from the clinic, it was stem cells like a placenta stem cells. That's the only thing I was told about. And yes, and it was done through infusion.
Was it painful or any
No,
side
no,
effects?
it is like any infusion. It is okay. It is not painful at all. But the only fear is that you may have a reaction to it from your body. But so far I'm okay. I do not feel bad.
And how long you've been in the clinic?
1 week.
1 week.
1
And
week.
you're going to stay for how long?
For another day. Then I'll,
You're leaving to the day after tomorrow.
yes, the day after tomorrow I'm leaving.
All right. Have you done something else except stem cells? Vitamins, physio?
Yes. Different kinds of vitamins, like vitamin B, and I'm not sure the other kinds of vitamins, but many of them I was given through infusion.
And have you done some kind of diagnostic part, blood test, EKG?
Yes. Many blood tests.
Many blood tests.
Yes.
Okay. Have you noticed any kind of improvements while you're in the clinic, or not? You haven't noticed so far because it's too early, right?
Yes, it is not yet really. I am almost in the same condition. Sometimes I feel better, but I am not sure whether it is a suggested feeling just because of the treatment. But this remains to be seen in the coming few weeks.
Coming few weeks.
Few weeks to 3 months. This is
what the
what I
doctors
was
told
told.
you. Yes.
Yeah.
What have you seen or heard about Swiss Medica that you decided to come to Swiss Medica?
Why did I decide to come here?
Yes.
Well, to tell you the truth, the name of the clinic, like it is run in Switzerland, it is by itself a good indication that it is a good clinic. Maybe this is my own look at it. The other thing is the stories told by many patients who came here that they benefited from the treatment.
Mm-hmm.
Yeah.
Mm-hmm. Have you seen the story similar to your case, to your condition, or you heard different stories with different conditions?
Not really the same of my condition. In my case also, I suffer from diabetes type 2, and many people benefited from that. I mean, their diabetes was either disappeared or became under control. So that was a main benefit from having the stem cells in their cases, and this applies to me. So if I benefit at least in the kind of in the diabetes area, that would be okay too.
Yeah, I'm not a medical doctor, but is your neuropathy related to type 2 diabetes?
No,
it's different, right?
it is different. Yeah,
Okay.
Neuropathy caused by type 2 diabetes can cause the same symptoms.
Yes.
But in my case, doctors told me that it comes from my condition of the nervous system. Because my diabetes type 2 is under control. My cumulative is 6 or under that.
Okay.
So it is mostly from the myelopathy in the neck.
Yes, I understand. have you considered any other clinic in the world?
Yes, I did. In fact, before I came to this clinic, back in October, I was in Thailand. I read about the treatments in Thailand that they would offer good treatments. I went there, but at the end, they told me the only way is to do stem therapy. Stem therapy in Thailand is very expensive. It was about 30,000 American dollars. Compared to the clinic here, it is very expensive.
So,
In general, stem therapy treatments in Europe is less expensive than the ones in the East, like in China or Thailand.
do you understand you correctly that you consider it only in Thailand, the clinic only in Thailand, right? And you decided between Thailand and our clinic?
No, my trip to Thailand was before I came here. I was not thinking even of stem therapy at that point. I was thinking that I could have a treatment of the spinal cord. But then they told me that I already have a myelopathy and no surgical treatment for that type of illness. It could be only cured or partially cured by stem cells.
By stem cells. And you didn't consider it any other clinics except us?
So far, no.
So far, no.
I would say yes. In fact, before I came here, I was in Poland. I was visiting my son there, and I went to a clinic in Krakow. It is a city about 300 kilometers from Warsaw, and I thought that they would offer stem therapy according to their site on the internet. I found out that that is not the case, and they are very limited in that area because of the rules there. They are not allowed to do it.
I see. Okay, and probably you would like to say something additionally. You feel free to say anything you want. If you have any feedback, if you don't have any feedback, that's okay.
Yes, fine. Thank you very much. I would say that I still have a hope in this treatment here, and research in this area is going on in the world in many cases, and maybe some results of experiments done on animals are very promising in many labs, so that could be a good treatment in the future.
Yeah.
Hopefully people in the future will benefit much more than now in the area of stem therapy.
Yes, and hope you will benefit.
Hopefully also I'll benefit from it
Yes,
soon.
yes. Wish you all the best.
Yeah,
Thank you very much.